Skin cancer is an extremely common form of cancer. In fact, it is the most common form of cancer. The good news is that even some of the most, what we consider deadly forms of skin cancer are actually very treatable and curable. Basal cell cancers are the most common, very common, in fact. They're actually fairly innocuous. They grow slowly. Surgery is usually a definitive cure. There are even some basal cell cancers which are very superficial, which we can treat with creams. And most people, even though they hear the word cancer, don't really need to worry about them so much, although they can be disfiguring if they get large. Squamous cell carcinoma is second most common. They tend to be rapidly growing growths, so patients are usually sort of more aware of them. Surgery is also usually a definitive cure. However, in 5% of cases, squamous cell cancers can metastasize through the body. Melanoma commonly, to most patients, looks like a really ugly mole. Often it's rapidly changing or growing, can even be painful. These need to be discovered, biopsied, and treated quickly. But if they are, the cure rate is actually very high. If we need to, we will do a lymph node biopsy if it is deeper, and that is done through a referral to a skin cancer center like Sloan Kettering or NYU. And there are new adjuvant treatments that are miraculous, are extending the lives of patients with metastatic melanoma for years now. The key to catching skin cancer is coming in for annual skin exams. One thing that I'm known for and have been known for throughout my dermatological career is being extremely thorough with my full body skin exams. I look everywhere and I spend a lot of time looking. I have seen thousands and thousands of skin cancers, so experience is everything. For patients who already have a lot of sun damage or who have a genetic predisposition, annual visits are probably the most important thing. Whether you are older and sun damaged because we never used to use sunscreen, or young and have a family history of skin cancer, we really want to start seeing people in their early 20s for annual skin exams. It's really the only way that we can make sure we can catch a basal cell, a squamous cell, and especially a melanoma. The outcome of skin cancer treatment is cure. We want patients cured. Obviously, in the case of metastatic melanoma, that's not possible, but with life-extending new biological therapies, patients have lived 7, 8 years, and we don't even know how long they're going to live because those trials are ongoing. So cure is definitely the goal. I know that a skin cancer diagnosis can be very, very scary. When people hear the word cancer, it makes people panic. But I want to reassure you that at Donnelley Dermatology, with our practice model of giving you so much extra time in your visit, and with my philosophy and reputation of being super thorough, you are going to leave your visit feeling that you had the best skin cancer check that you may have ever had. I've had lots of patients say that to me. You will be very well taken care of, and you will also be emotionally taken care of.